Hi, this is Dr. Adrian, MD. This is a short video introducing you to my hormone program for women. Some years ago, I learned that I had a hard time watching people age, especially watching beautiful women age. And this helped encourage me to have more of an interest in hormone compounding, or hormone replacement therapy. In the 1990s, I began studying the benefits of compounded medications, and I was using various compounding pharmacies. Now, the benefits of compounded hormones is that we can prepare topical or transdermal progesterone, which is not available commercially. We can also use the third estrogen, the weaker estrogen known as Estriol. Estriol has data which would suggest strongly that it may be protective against breast cancer. And this is why integrative doctors tend to use biestrogen, which means it has two estrogens. So back in the 90s, I began using various compounding pharmacies, and I was aware I was getting very inconsistent results as each compounding pharmacy did things a little differently. And so the benefit of this was that I learned that a particular formulation seemed to work the best. So around 2000, I began compounding my own hormones. And this has allowed me to have very consistent results in both my men and my female patients. So the typical patients who come see me are both pre, peri, and postmenopausal women. Now, premenopausal women tend to have what's called estrogen dominance, which means they have too much estrogen in proportion to progesterone. At the same time, they may also be hypothyroid, and progesterone deficiency can worsen hypothyroidism. Another common scenario is women who have been taking birth control pills for many years. Birth control pills do not have any progesterone. They have imitations known as progestins, which do have a progesterone effect in the uterus, but they worsen progesterone deficiency in the rest of the body. So women who have been taking birth control pills will have an increased risk of breast cancer, and may also have progesterone deficiency symptoms and estrogen excess symptoms. PMS is also due to insufficient progesterone, bloating, moodiness, tender breasts, painful periods, fibrocystic breast disease. So if you are premenopausal having any of these symptoms, and others as well, you may benefit from progesterone. In fact, most women after the age of 30 or 35, and even younger, often are deficient in progesterone. Now, perimenopausal patients are women who are around age 50 who are missing periods, and they start to notice that they are not functioning as they used to. They're having maybe poor memory or foggy thinking. They begin sleeping poorly, and then they get the obvious hot flashes, night sweats, and eventually vaginal dryness, decreased libido. So I see a lot of women who are menopausal, even some young women, who get on my hormone program and do very well, and often may feel better than they felt when they were younger, because now we can balance their hormones using the transdermal progesterone, biestrogen, or estradiol. And many women are also tested and found to be deficient in testosterone, which in my experience is really liked by my patients. It helps them not only with libido, but it helps them with work performance, with energy, weight loss, mood. So if you are going through menopause, I would encourage you to make an appointment to come see me. We have women who travel from hours away, even out of state, to come see me for my very affordable compounded hormone program. Many of these patients just see me once a year as required, and they do so well all year long that they don't need to see me any more frequently than that. So if you are a woman and you see yourself aging and not feeling like you used to, if you are younger, just had several babies, and your mood and your energy and your weight are not the same, you would probably benefit from seeing me. If you are older and going through menopause, I would encourage you to see me about your option to use compounded HRT, known as bioidentical hormones. It's very affordable, and we can control your dose and customize it for you specifically. And I think you'll be pleased with the results. This is Dr. Adrian, MD. Thank you for tuning in.